There are so many diet ideas and fads, well-meaning offers of advice, and options to explore when deciding what to eat to get through treatment and beyond. In this next session, Cara Anselmo, a registered dietitian nutritionist from Memorial Sloan Kettering Cancer Center, who specializes in oncology nutrition, will share evidence-based guidance with us. Thank you for joining us, Cara. I'll turn it over to you.
Hi, everyone. Thank you so much for joining me today. My name is Cara Anselmo. I am a clinical dietitian and registered dietitian in New York City. I work with Memorial Sloan Kettering Cancer Center. And I'm going to be talking today about eating well during and after ovarian cancer. So the American Cancer Society estimates that about 19,800 women will receive or will have received a diagnosis of ovarian cancer in the United States in 2022. And treatment options are continuing to increase and improve, which means that people are living longer with ovarian cancer, often with excellent quality of life. Though, of course, symptoms and side effects from treatments and/or the cancer itself may need ongoing management. If I could answer one question, it would be this: what is the ideal diet for ovarian cancer? And the truth is, it's not a simple question. It's not a simple answer. There's no one size fits all perfect diet. And what's ideal may be very different from one individual to another during different stages of treatment and through survivorship. So an example might be an individual who's experiencing acute diarrhea during radiation treatment would have very different nutrition needs and tolerances from someone who's on endocrine treatment and looking to decrease body weight, or someone who has severe loss of appetite or nausea during intraperitoneal chemotherapy. There's no individual foods that in and of themselves cause or prevent ovarian cancer or recurrence. I think that's so important to reinforce. It's overall dietary patterns that are most important. And diet and lifestyle changes can reduce risk for recurrence or for future primary disease. Diet and lifestyle changes can improve quality of life and reduce other disease risk, but can't guarantee prevention. So we do the things that are within our control. We do the best we can to reduce risk rather than for prevention per se. So we'll talk a little bit about optimizing nutrition during treatment for ovarian cancer, including the treatments listed here: surgery, chemotherapy, targeted therapies, radiation, and endocrine treatments. Starting with surgery, pre and post-operative nutrition. So our goals here are really to maintain lean body mass, to promote healing after surgery, and to help bowel motility and function. And in this box underneath, you'll see some of the ways that we can do this with nutrition. So absolutely important to get enough protein and calories from foods and drinks, to get adequate vitamins, minerals through a balanced diet, to hydrate well with water and other fluids, engage in gentle physical activity, assuming it's medically appropriate. And you can ask your dietitian, your nurse, or your doctor if you should be following a low fiber diet immediately after surgery, including debulking surgery, and then how to gradually increase the fiber in the coming days and weeks to help with bowel motility and bowel function. We're going to talk about all of these a little bit more detail too later. So chemotherapy, radiation, and targeted therapies. One of our goals here is, of course, to manage potential side effects. And I've listed some here: nausea, constipation, diarrhea, changes in taste, mouth sores, loss of appetite, fatigue. Not everyone experiences all of these, but we're going to go through them individually and talk about some ways to help manage these through nutrition. We want to maximize treatment effectiveness and promote treatment tolerance. We can do that by supporting immune function, reducing the risk for foodborne illness if you're immunocompromised, and actually avoiding most dietary supplements unless they're medically indicated. And we will speak about each of those in more detail. So I want to jump right into managing side effects with chemo-targeted therapies, etc. And nausea is unfortunately a common one, which can be managed with antiemetic medications, but we can also use nutrition and diet to help. So I encourage trying things, trying foods that are cool, that are cold, in some cases even frozen for best tolerance. Certainly avoiding strong food odors and limiting the time that you spend with food prep or in the kitchen. Eating and drinking just a little bit at a time, small amounts, might have to be more frequently. Trying ginger candy or tea, which can be very effective to take the edge off of nausea. I find that many individuals enjoy fresh fruits and find them sort of refreshing, soothing, things like watermelons, sliced apples, strawberries. I do encourage avoiding foods that are greasy, fried, oily, and trying bland and dry foods like maybe potato chips, saltine crackers, dry toast. And of course, those are not foods that you want to subsist on every day, day in and day out, but they can be really helpful in symptom management. Diarrhea and constipation are also common GI side effects or gastrointestinal side effects. In the setting of diarrhea, we first want to hydrate well, and that might mean including electrolyte-rich fluids. It could be Pedialyte, Noon tablets, or other fluids. We want to limit raw vegetables and try modest portions of well-cooked vegetables. Avoid fruit juices. Instead, choose modest portions of fresh or canned fruit. Try soluble fiber-rich foods like oatmeal, bananas, and again, avoid fried, greasy, or oily foods that can be triggers. We would encourage small, frequent meals rather than large meals. Sometimes too large of an amount in one sitting can cause diarrhea. And trying certain soluble fiber supplements like Vanatrol, which is actually made from banana flakes, and Metamucil, which is a natural soluble fiber supplement that you can buy over the counter. If diarrhea is acute, if it's really if someone's struggling with it, they can always do some plain cooked white rice, plain boiled chicken, mashed banana, applesauce, cooked egg whites. These two foods tend to be very tolerated. And again, they're not forever, but in acute situations, they can get you through. In the setting of constipation, again, hydration is important. Here's where we want to gradually increase fiber. And I've listed some fiber-rich foods here in different categories: whole grains, vegetables, fruits, beans. These are just ideas, certainly not an exclusive list. Some people find help with dried prunes, prune juice, dried apricot for constipation. I encourage including healthy fats and oils like olive oil, flaxseed, avocado in practical portions. And decreasing refined carbohydrates like white rice, white breads, other white flour products. Again, soluble fiber supplements can be helpful with constipation as well as with diarrhea. And sipping on a hot beverage first thing in the morning, like some hot water with lemon, or if it's medically appropriate and palatable, coffee or tea can also help with constipation. Changes in taste or a metallic taste in the mouth. We can try flavors like lemon, lime, or mint, which can counter that metallic flavor. And that might be adding fresh slices of lemon to water or doing a sugarless mint gum or candy, obviously in limited amounts. You can use wooden or plastic utensils rather than metal. This actually helps with that metallic taste. Try drinking through a straw. A lot of people find that meats don't taste good, so there's plenty of other protein sources. You can limit meats and choose instead something like yogurt or whole grains. Again, cold foods, cool foods, and drinks tend to be more tolerable. And with changes in taste, I always encourage just choosing what's palatable, and for individuals and family members to not force it. Sometimes adding small amounts of sugar, honey, a little bit of fresh or dried spices or herbs can make all the difference in changing the flavor to make it more palatable. And of course, good oral hygiene. So if it is appropriate to brush your teeth, doing so and or using appropriate mouth rinses. Mouth sores, a little bit different. We want to choose cool foods, creamy, soft, bland foods. Avoid anything with hard edges or jagged pieces. It can be helpful to change the consistency of the food. So, for example, doing something blended or pureed. Avoiding extremes of temperature, things that are really hot, and also things that are really spicy. Avoiding acidic foods or drinks like citrus, tomato sauce. Trying sipping drinks through a straw just to reduce the exposure to the oral mucosa. In some cases, using high calorie, high protein supplement drinks or homemade shakes and smoothies can be a nice way to get in calories and protein. And again, that oral hygiene, trying a baking soda mouth rinse, saline rinse, or biotin, for example. The loss of appetite or just loss of interest in food is a tough one. So of course, I encourage choosing foods that are most appealing at any given time. It's okay to eat favorite foods and trying to eat and drink in just small amounts. So again, not forcing it, but a little bit at a time, frequently through the day and the evening. Sometimes it's nice to try different flavors, textures, temperatures, just for variety to see what's most tolerable. And that can change from day to day or week to week. Do make sure that you're getting in high protein foods. That could be things like eggs, beans, yogurt. And that's important for maintaining lean body mass. But it's also okay to have a piece of fruit or to have a cracker and a grain if that type of thing feels satisfying and palatable. Using protein-rich nutrition supplement drinks and homemade shakes, again, can be nice if you don't really feel like eating solid food. Sometimes it's easier to drink, not forcing it once again. And if you are a caregiver, not trying to force someone to sit down to a meal per se. The goal is really to get enough nourishment, however it's most comfortable at the end of the day. And that might be through just small amounts or not sitting in front of a whole plate of food or even sitting with family and friends. So fatigue can be a side effect with all of these treatments. Really just, again, focusing first on protein-rich foods that can help with energy level, avoiding skipping meals, even if you're tired, trying to have a little something, and to hydrate well too. Sometimes fatigue is worsened actually with dehydration. Having on hand foods that are easy to eat, easy to prep, like an individual yogurt cup, plain packets of instant oats. Canned foods can be nice here, like canned tuna, salmon, frozen foods, or already prepared foods. And if you are able to call on friends and family to help with getting food and cooking, this is a great time to do it. If you are up for doing any amount of cooking yourself, maybe you make a little bit extra, and that way you can freeze it and have leftovers. Keep it simple. Spend less time in the kitchen if possible. This is not a time that you need to do anything elaborate. Try to limit caffeine to the early part of the day and not have it in the afternoon or at night. Sometimes we rely on caffeine to help manage fatigue, but it can interfere with sleep if you have too much of it or have too late. And we do want to maximize sleep as able. Sometimes people tell me that they're very fatigued and they're eating okay, but they're not really sleeping much. And clearly the issue there isn't diet, it's the sleep. Engaging in gentle, medically appropriate physical activity, movement can also help with fatigue. So moving on now to endocrine or hormone therapy. This is where we want to manage potential side effects as well. And they can be things like joint pain, hot flashes. We'll go through these. So in the setting of joint pain, physical activity can be extremely helpful. This can be gentle movement. It doesn't have to be an intense workout. Overall healthful, balanced, anti-inflammatory foods and an anti-inflammatory diet. And oftentimes people think that means something very specific. You have to eat this one food or this one fruit or vegetable. And, again, it's dietary patterns that matter more than specifics. So a diet that is more whole foods, plant-based, includes veggies, fruits, protein-rich foods, healthy fats. In the setting of hot flashes, there are some food triggers, so we encourage avoiding these potential triggers. They can be very hot foods and drinks, hot in terms of temperature or spiciness. alcohol, caffeine, coffee, chocolate, some of these old favorites can be triggers to try to minimize those. We do know that certain types of hormone therapy can contribute to bone loss. So, of course, important to engage in weight bearing and strengthening exercises to get enough calcium from foods and or supplements if need be. And to get adequate vitamin D, which may need to be supplemented, particularly in the winter and depending on where you live, your latitude, since we get most of our vitamin D from sun exposure. And lastly, unintended weight gain can be a result of endocrine therapy. You've probably heard all of these things before: portion control, limiting sweets and added sugars, engaging in mindful eating, avoiding late night eating, increasing whole vegetables, increasing physical activity as medically appropriate, getting enough sleep. And if you have really worked on all of these things, if you're trying all these diet and lifestyle strategies and still struggling very much, asking for a referral to an endocrinologist to see if there's something else going on under the surface, and if some sort of medication management might be useful. But I've mentioned hydration as being important a few times already, and it really is in all of these above treatment settings. So for most adults, I'm going to encourage at least 2 liters a day of water or other drinks. You can add lemon, lime, cucumber, mint. You can do plain seltzer, flavored seltzer, mineral water, unsweetened iced teas. All of these count towards your hydration. Some people find they can drink more through a straw. And keep in mind that things like frozen fruit puffs, ice chips, sorbet, those can be helpful in replacing water and complementing water and fluids. Hot teas, hot water with lemon, hot cocoa, hot drinks are fine, they count. And things like broth, fresh vegetables, fruits that have a high water content, all of these help maintain hydration. So certain treatments do cause immunocompromise, and we want to be extra careful with food safety and handling during these treatments. These are some basic tips. Washing hands before eating, drinking, and meal prep is my #1 tip. Cooking meat, poultry, eggs, and fish thoroughly. Avoiding things like sushi, salad bars, raw meats, so none of that tuna tartare. Avoiding unpasteurized products like raw milk cheeses, kombucha. As far as doing raw veggies and fruits, generally rinsing them under running water is helpful. And you don't need to buy fancy sprays or washes, just regular water does work. Keeping hot foods hot, cold foods cold. And you can learn more about food safety and handling at the website that I've listed here, fda.gov. This is not meant to be, again, an entire exclusive list, but these are some ideas for kitchen staples and shopping lists. So these are not all things that you have to have. They're suggestions for what you can keep in the fridge, the pantry, and the freezer, just to have foods on hand so that, again, if you're tired, if you're not feeling great, you have things accessible, you have things where you can kind of assemble a meal rather than have to do any big cooking. So just some examples from each. For the fridge category, any type of vegetables, herbs that you like, fruits, eggs, tofu, tempeh, fresh cheeses. Don't be afraid to do pre-made foods like a pre-made hummus, pesto sauce, and whole grain breads, pitas, roti, English muffins tend to last longer if you keep them in the fridge. Nut butters, many of those do need to be kept in the fridge. And then with the pantry, the shelf, canned foods, dried foods, don't be afraid to do things that come in a jar or a box. Doesn't have to all be from scratch. In the freezer, you can keep different varieties of frozen vegetables, things like veggie burgers or salmon burgers. And frozen berries can be very nice, particularly for making smoothies. So these are just ideas, just things to give you a little inspiration. So what's the best diet after treatment and through survivorship? So if you've already been through surgery, chemo, you're kind of past that, what now? So research suggests that optimal dietary patterns are plant forward. Now that doesn't mean they have to be vegan or vegetarian. They can be, but they don't have to be. They include a variety of whole vegetables and fruits, grains, that could be things like whole wheat, oats, brown and black rice, buckwheat, quinoa, beans, nuts, healthy oils like olive oil, avocado. Optimal dietary patterns limit added sugars. So this isn't just the sugar that you add to your coffee. This is also the sugar that you find in baked goods, desserts, sweets, sweetened drinks like sodas. Optimal dietary patterns minimize red meats. Sometimes people ask, well, what's considered a red meat? Easy way to think about that. Anything that had 4 legs is considered a red meat, nutritionally speaking. And especially minimizing or avoiding processed meats that have been linked to different types of cancer risks. And that would be your cold cuts, ham, sausage, bacon, hot dogs. We also see that minimizing alcoholic drinks can be helpful. We do know that excess alcohol or higher levels of alcohol are associated with different types of cancer risk. So keeping to a minimum, if you do drink them, things like beer, wine, or liquor. So next section here, we want to talk about some frequently asked questions, some FAQs, specifically about nutrition and ovarian cancer. So let's jump right in with this very common question that I get. Can I eat soy foods with hormone-sensitive cancers? And I hear this in the setting of ovarian cancer, breast cancer, other types of cancers. There is abundant research at this point that it's safe, appropriate, and possibly even beneficial to include whole soy foods like tofu, tempeh, soy milk, edamame. For individuals who have or who have had a history of hormone-sensitive cancers, eating soy foods is not associated with an increased risk for recurrence or other negative outcomes. Often we hear this word phytoestrogens, which really just means plant estrogens. And it sounds kind of scary, right? But it's actually not the same thing as the estrogens in our bodies. They don't increase our body's estrogen levels. So these quote unquote phytoestrogens are not something that in a whole food form increase cancer risk. Should I follow a ketogenic diet? So before we even jump into should we follow this, what is it? And it's not just a low carb diet. It's actually a very, very high fat, low carb, moderate protein diet that induces a state called ketosis, where the body creates ketone bodies. And these can be used by the brain and other organs to function when blood glucose is just too low to use as a fuel source. So research on the keto diet in the setting of gynecologic and other cancers is ongoing. And in certain very specific scenarios, the diet might be appropriate. But to date, the keto diet doesn't seem to be the best option overall for fighting cancer. Couple of risks, things to consider. It may contribute to excess weight loss and undernourishment. It can be hard to sustain on a practical level, especially during treatment. It's very, very restrictive. So if you are thinking about this type of diet, talk to your registered dietitian, your physician, your nurse, just to make sure that it is safe for you and wouldn't compromise any of your treatments. What about intermittent fasting? So again, studies in humans are preliminary. We have a lot more data in animals, but we know that animals and humans' metabolisms can be very different. It's unclear if intermittent fasting can help to reduce tumor burden or improve the effects of chemotherapy. We can't, unfortunately, starve cancer cells with diet. And intermittent fasting may result in unintentional weight loss, including lean body mass like muscle and bone. And we see that over time, that loss of lean body mass is actually associated with poor outcomes for many people. Some types of time-restricted eating, sometimes you'll see that listed as or abbreviated as TRE, may have benefits in the setting of diabetes or metabolic dysfunction. That's a different talk entirely. And Both intermittent fasting and time-restricted eating are unlikely to be helpful with weight reduction unless they help reduce overall calorie intake consistently and over time. So if someone tends to eat too much at night, and that's where they're just taking in excess calories and they decide I'm not going to eat after 7 p.m. and this helps them, great. If, on the other hand, you're eating the exact same amount of calories in a 6-hour window versus an 8-hour window or a 10-hour window, it's probably not going to matter a whole lot. Big question, does sugar feed cancer? You see this all over the news media, social media. The relationship between sugar and cancer is complex and definitely not direct. So let's break it down. Blood sugar or blood glucose feeds both healthy cells and cancer cells or potential cancer cells. Interestingly, cancer cells are crafty. They can use other substances to grow too. So they can use vitamins, amino acids, ketones. Eating a food that contains a certain amount of sugar doesn't somehow directly contribute to cancer growth or tumor spread. It's not like the sugar goes right to it, causes it to grow. All of this said, excess sugar consumption, which is usually in the form of added sugars and those things like baked goods, snack foods, sodas, excess consumption can be harmful, including contributing to obesity and sometimes displacing more healthful and possibly cancer protective foods. Just to go back to obesity, we do see that that's linked with a number of different types of cancer. Clearly, it is not always caused by excess calorie or excess sugar intake, but that is one potential contributor. So bottom line, it's best for overall health to limit added sugars and choose appropriate portions for foods naturally containing sugar, but there's no need to avoid foods like fresh fruits or vegetables or whole grains. So enjoy those. Do I need to buy organic? Well, let's start with definitions again. So organic plant foods are produced without synthetic pesticides or herbicides. So that doesn't mean they don't have any pesticides. It just means they're not synthetic ones. Organic animal foods are made from animals that have not been given any antibiotics. They haven't been given any added hormones, and they haven't been fed feed from animal byproducts. The research to date actually does not show a relationship between choosing only organic foods or mostly organic foods and reduced cancer risk. I tend to think that the important point here is eating the vegetables and fruits, again, dietary patterns, eating them full stop, rather than feeling like you can only eat them if you can get organic. So the benefits with veggies and fruits and these whole plant foods really go a long way. I also wonder about a halo effect. I think that they sound helpful and pure, but they're not necessarily good for us. For example, organic sodas might contain organic cane sugar, but sugar is still sugar. We've been talking a lot about a plant-based diet or a plant-forward diet. Should you go vegan? Well, a healthy plant-centered diet does not have to be strictly vegan or even vegetarian. It can be, but it doesn't have to be. But if you want to go more plant-based, start thinking about bringing more whole plant foods just into your daily and weekly rotations, more vegetables, more whole grains, beans, maybe looking at those foods as the stars of the plate rather than having to start with an animal protein. You can, of course, choose a vegan or vegetarian diet based on personal or ethical preferences, and you can get everything that you need. On a vegan diet, you do need to supplement B12, which is easy enough. And consider food quality and quantity, not just whether or not it's plant or not. So pretzels and Oreos and vodka are all vegan, but they may not be the most nourishing choices for every day. And of course, too much of anything is too much. Dietary supplements. And again, this could be a whole talk in and of itself, but I want to touch on the more important points. Based on recommendations from the American Institute for Cancer Research and most cancer dietitians, it's really best to get nutrients from whole foods as much as possible. Some concerns about dietary supplements. So they're unregulated by any federal body before going to market in the United States, which is a little scary. So the industry is policing itself. This means there's higher risks for things like adulterated products, contaminated products. We often see in independent testing that what's on the label isn't what's actually in the product, in the pill, in the bottle. There's risks for drug nutrient, drug herb, and herb interactions. Sometimes supplements can interfere with treatments like chemotherapy and radiation therapy. And they can result in liver damage, interfere with nutrient absorption, cause toxicity, and even death. Just very recently, this was highlighted in the news. There was a congressman in California whose wife died after using a white mulberry leaf supplement to help with weight loss. So really, really sad. It is typically recommended to take supplements if you have a known deficiency or to prevent a deficiency, of course. And to that end, vitamin D may need to be supplemented. So we really don't get much vitamin D from foods. We usually get it from sun exposure. It's important not to over supplement any nutrients, even vitamin D. Too much is still too much. Too much of any bioactive substance can be just as dangerous as not getting enough. I get this question frequently, and I love it. Is caffeine, including coffee, okay? And yes, I will never take away someone's morning coffee. It's fine for most adults to have a modest amount of caffeine, like 1 or 2 cups of coffee or tea, unless, of course, it causes unpleasant effects like rapid heartbeat, shakiness, anxiety, reflux, abdominal discomfort, or sleeplessness. Then it might be time to cut back or avoid. Keep in mind that coffee and caffeine can act as bowel and bladder stimulants, so it might be best to avoid them if you're experiencing diarrhea or loose or frequent bowel movements or urinary urgency or incontinence. What can I eat to boost my immune system? I've been asked this many times. So immune systems are complex. It's not just one organ. It's not just one part of us. And they work best with an overall balanced diet that contains a variety of whole foods. Back to that dietary pattern idea versus specific foods. That said, we do want to include whole plant foods. I've listed some here that may be particularly beneficial, like citrus fruits, garlic, nuts, seeds, spinach, berries, melons, mushrooms, and any type of fresh or dried culinary herbs and spices. Your immune system needs protein. Foods like fish, tofu, beans, whole grains, eggs. We do best with limited alcohol. So too much alcohol can wear us down, and it is important for the immune system to stay physically active so that our bodies, can fight infection. And that gentle physical activity, again, it can be gentle. It doesn't have to be something like a really hard workout every day. Getting plenty of sleep is important. Our immune system can't function without enough sleep. I would avoid most dietary supplements marketed for immune boosting. Most of those are more marketing than science. And do have your vitamin D levels checked and supplement if need be, because our bodies do need adequate vitamin D. And again, that's the one nutrient that can be really tough to get from foods alone. So some conclusions here. I think as we've discussed, there's no one best diet for all individuals who have or have had a diagnosis of ovarian cancer. A diet rich in vegetables, fruits, other whole plant foods, a diet that promotes a healthy body weight for any individual seems to be the best dietary pattern to decrease cancer-related risks over a lifetime. Extremely restrictive diets may be more harmful than helpful. We've seen that nutrition can be used to manage cancer and treatment-related symptoms and side effects. There are no dietary supplements recommended to reduce cancer risk in and of themselves, though certain vitamin and mineral supplements might be necessary or helpful if you can't get enough of them from foods. And I would go back to those examples of vitamin B12, for example, if you're on a vegan diet, or vitamin D. And of course, speak with a registered dietitian for more tailored and personalized nutrition information. If there is an RD at your cancer center, wonderful. You can ask your primary care doctor, your medical or surgical oncologist, or your nurse for a referral or a recommendation, and they should be able to help you with that. So I want to thank you so much for your time, wishing you good health and wellness.